Right. My name is Puhan He. I'm an assistant professor at the University of Pennsylvania in the Department of Oral Surgery. Oral surgeon is somebody who went to dental school training, but also has received hospital training so that we can manage more complex cases. We do surgery, we're surgeons who work on the jaw, teeth, mouth, as well as the face. So usually this may involve, procedures like taking out wisdom teeth, more complicated extractions, and somebody with other medical issues that needs to be managed, or even infections that come in the hospital, and also trauma as well. So the things that most people know that oral surgeons do are things like wisdom teeth, implant placement, complicated extractions, and those are kind of our bread and butter. However, we also do, especially, we also work both in a hospital as well as office setting. So the things that surprise people are the things that we do in a hospital. So we work with orthodontics, our colleagues orthodontists very closely so that we can manage patients with facial deformities or patients with obstructive sleep apnea that need surgical treatment. We also work with our medical colleagues to manage infections, to manage trauma, head and neck trauma that comes into the hospital as well. We certainly also look at lesions that grow in the mouth so that we can do biopsies and figure out how to manage these lesions, whether they are benign or malignant. It has changed in a lot of ways. A lot of more procedures, procedures are more accessible because we have adjuncts that help us make the patient feel better and more relaxed during the procedure. Examples are using nitrous oxide and also being more accessible to IV sedations. Because we receive training in anesthesia as well, we can provide IV sedation safely to patients, which can help get the procedure done in a less anxiety provoking way. The other things that have changed is really planning softwares have come a really long way since I started this journey. And because of being able to use those software, a lot of times surgery can be less invasive, time consuming, and thus have less issues afterwards. Those are kind of the two big things I feel like has really changed. And I think the last thing would be a lot of the education around surgeons have changed in a way that is more patient centered. We work with our colleagues are in interdisciplinary teams a lot more compared to before. And so the care delivery and the patient relationship is a lot more improved as well. For third molars and wisdom teeth extractions, we typically tell our patients that the procedure itself, you can choose between getting it done with some nitrous oxide or with some sedation. Generally, patients that have full bony impacted teeth, meaning they're completely buried inside the jaw, we would recommend some sort of IV sedation so that you're most comfortable. These procedures generally itself take about, if you have all four wisdom teeth, take about an hour or 2 hours, depending on how long it takes for you to fall asleep and for you to wake up. And then recovery is kind of a lot of the swelling and pain happens in the first 2 to 3 days. Most people recover fully by a week. And if you're younger, maybe even sooner. In terms of what you go home with, there's generally pain medications and sometimes antibiotics as well. For implants, the procedure, most people just feel that they do it awake. Most people feel that the procedure itself is more easy than getting an extraction. And I believe that's the case as well. Generally, it takes about 20 to 30 minutes for a single implant. And because there's not a lot of the pressure that comes with extractions. Implants generally are very well tolerated. And similarly, kind of swelling pain is around the first 2 to 3 days. And healing, we usually have a follow up at around 2 week time just to make sure that all the soft tissue and everything has healed appropriately. And similarly, we do pain medications as well as antibiotics. For somebody who's curious whether we are the right team for them, I think it's always helpful to chat with, do a consultation, chat with us, and kind of just pick our brains in regards to the direction that they should go. We are in a really great position to offer advice because we are both in the medical and dental world. So that being said, if questions come to us where we feel like we can direct them to other dental specialties or whether they need to see their medical specialist first before getting a procedure done, we're kind of placed in a very good position to give advice. And generally, I think just meeting and chatting with your oral surgeon will help calm any nerves that you may have, and that can really help get you the procedure that you would need as well.